So I am Ouassila Boudah, International Business Manager at the Bioarray Lab, and I will present the webinar today. As you know, Bioarray is a genetic diagnostic lab founded in 2008. We exclusively do genetic diagnostic, including the reproductive genetics diagnostic tests. So today we are in the presence of three professionals who will share their experience with us regarding the vaginal microbiome and their experience of using our test, the MicroV test. So allow me to introduce our speakers today. So we have Dr. Luis Alcaraz and Dr. Miguel Raimundo.
Yes, thank you.
And of course, Dr. Joaquin Llácer.
Hi, good afternoon.
Thank you and welcome. And of course, if you have any questions, okay, please write down on the chat and we will be more than happy to answer to your questions today. We will start with our first presentation. It will be done by Dr. Luis Alcaraz. Hi, Luis.
Hi.
So, but first I have to introduce our Dr. Luis Alcaraz. So he is the technical director of Bioarray. He founded Bioarray in 2008 together with our CEO, Andres Anton. And he is a molecular biologist and a researcher in the field of proteomics and genomics using high-throughput techniques such as NGS, massive sequencing, and the DNA microarrays, of course. He is also a specialist in bioinformatics, and he had various research positions in both public and private entities. And he is now currently a professor of biochemistry at the University of Alicante in Spain. So welcome, Dr. Luis Alcaraz, and go ahead with your presentation. Thank you.
So thank you very much for this nice introduction. I'll try to share my screen. Okay. I think you are seeing my presentation, right, Ouassila? Okay, perfect.
Yes, okay. Thank you.
So thank you very much to all of you for being here for this webinar. We have prepared, I think, a very interesting session with great speakers. So I'm going to be very brief. I will start my presentation and I will talk about the pivotal role of the vaginal microbiome in ART success. So it's not working, I think. Yeah, so now it's working. So over the last decade, interest in how the microbiome affects our health and diseases has grown significantly. In particular, for today's topic, it was discovered some time ago that the vaginal and endometrial microbiomes are crucial to the health of the reproductive system. First, to achieve a pregnancy, not only do we need a healthy and viable embryos, it is also essential to have an intrauterine environment that favors the implantation and growth of the embryo. This microenvironment includes the microbiota and the local immune system that have to be worked together to ensure good communication between the embryo and the endometrium. So understanding the complexity and impact of both the endometrial and vaginal microbiome is fundamental to unraveling their role in assisted reproduction, and as such, it has been studied for several years. This is one of the first studies about the endometrial microbiome, where an endometrial microbiome rich in lactobacillus is frequently associated with successful cycles of assisted reproduction and live birth. Moreover, in the group of non-pregnancy and those who had miscarriages, the presence of some pathogens in the endometrium was relatively common, as you can see here in red and here also in red. So understanding why microorganisms are so important for pregnancy is a very interesting topic, but I will not go deeper into this since the experts who follow will develop more on this and other interesting topics. So until recently, the studies were more centered in the endometrium, but very recent studies highlighted the importance of the vaginal microbiome. And in particular, not only for natural pregnancy, which has been known for many, many years, but also in assisted reproduction cycles. And, you know, this makes sense because we know that the microbiomes from the vagina and the endometrium are obviously connected. Actually, we can take a slight further step and even adopt a let's say, more holistic view of the human microbiome, because it seems that everything is somehow connected. A few years ago, we conducted an interim study in which we study the microbiome of different parts of the body in 52 women with a history of recurrent implantation failure. We analyze oral, gut, endometrial tissue, endometrial fluid, and finally the vaginal microbiome in this one. What we found is that in general, there was a high correlation between different samples, but especially between the oral microbiome and the reproductive tract, and especially when we found dysbiosis. That is, when we had an endometrial or vaginal dysbiotic, as we can see in this case, in this patient, in which we had a Gardnerella in the vagina. Then when we analyzed the oral sample, we found also dysbiosis in the oral cavity. In this patient, we found a high presence of Rothia, which is an oral pathogen associated with the onset of caries. The curious case here is that after an appropriate treatment and the reestablishment of a normal microbiota in the vagina, we observed that the oral microbiota was also normal and predominated by Streptococcus, which is the most abundant bacteria in a healthy mouse. So it seems that acting on the vaginal microbiome somehow influences the oral microbiome. So it seems that if we work in a microbiome in one part of the body, this may affect other microbiomes. Indeed, this is the basis for the oral probiotics that we often prescribe when we find dysbiosis in the endometrium. However, it is interesting that despite these relationships and the knowledge that the vaginal and endometrial microbiomes are related, it remains a common practice to focus only in the endometrial microbiome when studying patients undergoing ART, and disregarding the rich information that the vaginal microbiome can provide. This information includes not only the success of the assisted reproduction cycle, but also the likelihood of spontaneous miscarriages and even the health of the baby during the early stages of life. In summary, what we know today is that while endometrial biopsy is the gold standard for studying the microbiome of the reproductive tract, it has some problems. Dr. Llácer will cover deeper this subject, but essentially the main problem is that it requires a biopsy. That is uncomfortable for the patient, the need of waiting for the tissue to heal. Also, there is generally low biomass in the endometrium, meaning that it's difficult to study and it is also easily contaminated. In any case, again, in the following talks, Dr. Llácer and Dr. Raimundo will elaborate more on this and what can we do in case of dysbiosis. So from a technical point of view, all the progress in studying and understanding the influence of both vaginal and endometrial microbiomes on assisted reproduction cycles has been really driven by next generation sequencing techniques. These techniques allow us to study the microbial composition of any sample in a very simple, fast, and economical way. The technique involves the amplification of a part of the bacterial genome known as 16S. This gene is very useful for identifying microorganisms because it has regions that change very little between different species, that is the conserved regions, and others that vary more, that is variable regions, that are those ones in green. So it's an ideal tool for determining genetic differences between bacteria, which helps to identify and classify different species and even bacterial strains. Using the sequence obtained and the databases, we can determine which microorganisms are present in the sample and their relative abundance. The use of 16S is particularly popular in clinical microbiology studies because it allows us to identify bacteria and archaea that cannot be cultured in the laboratory. This tool is therefore very useful because it provides detailed information not only about the composition of microbial community, but also about their dynamics. At Bioarray, we offer a test that we name MicroB, which analyzes the reproductive tract microbiome through a next-generation sequence. The difference with other tests available in the market is that we propose to analyze both the vagina and endometrium together. Although, of course, the analysis of the vagina is recommended but optional. What we usually obtain is represented here. These donut charts represents the diversity of both vagina and endometrium. Here in this example, we find that the vagina is mostly dominated by lactobacillus, which appears in red here. And then we find a very small proportion of some other species. This result would correspond to a biotic vagina. The corresponding endometrium presents a very similar profile, although the diversity of the species seems to be somewhat greater than in the vagina. We logically find a predominance of lactobacillus, but also the presence of some other species such as Cinetobacter, Phragmobacteria, and so on. So while in this case, the information provided, by both the vagina and the endometrium is somewhat redundant, because in both cases we are seeing a biotic result, there are many cases in which it is important to have the information from both tissues. Indeed, when we were setting up the technique and we were studying the concordance between the vagina and the endometrial microbiome, in the majority of the cases, we found a total concordance, as I already mentioned. But it's not always so simple. In 23% of the cases, we found that the endometrial sample was contaminated by the vaginal microbiota, indicating that we were seeing a reflection of the vagina rather than accurate picture of the endometrium. In 12% of the cases, the biomass of the endometrium was too low to obtain reliable results, which highlights the importance of the vaginal sample for obtaining some information about the genital tract microbiome. And what was more intriguing is that in almost 20% of the cases, we had contradictory results between the tissues, with one tissue presenting a normal biota and the other showing dysbiosis. Interestingly, it was the vagina that tended to be dysbiotic, despite the endometrium appearing normal. This is extremely important, as an altered vaginal microbiome can impact the success of the assisted reproduction, even if the endometrial microbiome appears to be to be in good condition. Firstly, because it is possible that an infection appearing in the vagina, as in this patient, will eventually spread to the endometrium. So the study of the vaginal microbiome is giving us an early indicator of a potential endometrial infection. Furthermore, it is well known that microbial infections in the vagina are related to gestational losses and preterm births, in addition to altering the immune system and causing inflammation that can affect the endometrium. In this image, you can see how pathogenic bacteria affect the integrity of the vagina by producing amines that raise the pH and affecting the growth of lactobacillus. As results of this process, which can be observed here, the bacteria manage to degrade the mucus layer and reach the vaginal epithelium. So, combining the information of the vagina and the endometrium can be very, very relevant for a large number of patients. Microbe obviously analyzed the relative abundance of lactobacillus, which, as you know, is an important biomarker of the reproductive tract health, and probably following speakers will discuss in detail. Microbe also allow us to obtain information on the presence of up to 16 different pathogens. This is the current list of pathogens that we analyze right now. And one of the most striking findings when we were implementing this service was the high incidence of dysbiosis in patients, both in the vagina and the endometrium. In our hands, about 25% of the samples analyzed reveal dysbiosis with the presence of pathogens. This data blows my mind and raises the question, why isn't this carried out as a standard procedure in all the patients? What makes this issue even more critical is that the majority of patients tend to respond positively to treatment, and some of them even achieve spontaneous pregnancy after reestablishing a normal flora. So, while it is true that obtaining an endometrial sample can present its difficulties, our experience shows that in most cases, with the vaginal sample, we can have enough information to guide clinical decisions. Lastly, regarding the abundance of the pathogenic bacteria we find, as you can see here, Gardnerella and Enterococcus are the most frequent, but there is a wide diversity. So, just to finish, these are the key take-home messages on this talk. First, we usually study the microbiome of both vagina and endometrium. The study of the endometrium is obviously important, but in our opinion, the addition of the vagina provides useful information for many, many patients. Also, we found that dysbiosis is a frequent cause of infertility, and for this reason, it is important to control not only the presence of pathogens, but also the abundance of lactobacillus. So that's all from my side. Thank you very much, and I'm glad to take questions.
Now, it's my pleasure to introduce our second doctor, who is Dr. Miguel Raimundo. So welcome, but before you start your presentation, I want to do a brief presentation of Dr. Raimundo. Dr. Miguel Raimundo, sorry.
Yes, thank you.
Yeah, Dr. Miguel Raimundo is a specialist in gynecology, obstetrics, and reproductive medicine. He has been working in different assisted reproduction centers and clinics in Portugal and Belgium for over 7 years. He is the author of more than 85 lectures at national and international technical and specific scientific meetings. And he is the author and co-author of several publications in national and international journals and books. So thank you for being here, and you can go ahead with your presentation, Dr. Miguel. Thank you.
Thank you, Claudia. Thank you, Bioarray, for this opportunity. And Luis explained what is microbiome, and now what do you do with this? Sorry. Okay, at the beginning, I do an introduction with assisted reproduction treatment. Next, Luis explained the vaginal microbiome and the impact of success rate. And next, I will speak about the future and my study about microbiome and the impact of fertility. Okay, we know. Assisted reproduction treatment, we have two big treatments, IVF or ICSI, but the pregnancy rate, it's not 100%. And we need to create, and we know study why we do not increase the pregnancy rate and live birth rate. The microbiome and study microbiome, it's important because it's intervention in reproduction, intervention in quality of the eggs, quality of the embryos, the receptive of the embryos. In this study, we created the vaginal microbiome creating 5 groups: Lactobacillus crispaceus, Lactobacillus gazulosis, Lactobacillus inercis, Lactobacillus polymicrobianas flores e os Lactobacillus ginzennis. And in different phases of the human, we have different concentration of these groups. Okay, in the pregnancy, we have more Lactobacillus crispaceus, but for example, during the period, we have more or less of Lactobacillus crispaceus. These influence, these groups of microbiome, of Lactobacillus affect our fertility. The vagina produce microbiome substances and specific immunization system. Luis spoke about this. Protect interactivity of mucosis and factor secretion of mucus. And this is impact of inside the uterus. There are a lot of articles who explain this. This is an article with a big study in 2021. Another, it's analyzed on Lactobacillus crispaceus, these Lactobacillus during the pregnancy with high doses, high concentration. But we have more in the man, in the human, in the man. Again, who affect the factor who influence the microbiome? The stress, the system, when you have problems who affect the system of immunization, the lifestyles, and another case, who demonstration there, and change the microbiome in vagina. In the future, what do you, we studied the microbiome, we know who affect microbiome affect the fertility. What do you do with this? I think in the future it's possible to create a new line of medication, a probiotic, postbiotic, prebiotic, who create a microbiome perfect for the pregnancy. This year, I will start a study with ProResearch. It's a company who do studies about probiotics, and we create 2 groups. One group, it's patient only with female infertility, in one group who probiotics, and another group with placebo. And we to monitorize the blood tests and the microbiome vaginal during 6 months. And during these 6 months, we analyze if increase the pregnancy rate or not increase the pregnancy rate. This study, we study only these lactobacillus, but we know if this is the best or no lactobacillus. But in the previous study in Hospital da Paz in Madrid, we have good results, and we create more patients and select only for female infertility, and we study this group. Now, case study. This patient is my patient with 34 years old. She did 3 IVFs with 6 embryo transfer and zero pregnancy. I do a microarray and we will check the flux vaginal with this microbiome, and we analyze specific zones. We detect the Enterococcus and we detect the Enterobacteriaceae. What do you do? Start 2 antibiotics, one for Enterobacteriaceae and another with Enterococcus, and next 6 months with probiotics. During these 6 months, the patient spontaneous pregnancy, and now with normal delivery, and 1 year after this pregnancy, we pregnancy again. Probably this dysfunction of microbiome affects, because one patient is 34 years old with 3 IVF without pregnancy, I know the statistic, it's not 100%, but probably this effect of the pregnancy rate, and we create and you cure this patient. For conclusions, this study on we create a big group on microbiome vaginal, and we have create an impact with the pregnancy rate, and we propose the conclusion to probiotics, the treatment to improve the pregnancy rate. I think we need more studies. We know which probiotic we use, which SEPA we use, but we need to create more evidence with this. At this moment, we have microarray for select the microbiome study microbiome, but we don't have any arm to affect directly to the microbiome and have impact to success rate in IVF. Okay, questions?
We will answer to all your questions. Now we will go ahead with our third presentation. This presentation will be done by Dr. Joaquin Llácer, and let me introduce you. So welcome first at Bioarray, and thank you for being here. And of course, I will do a brief presentation. So Dr. Joaquin Llácer is actually the medical director of Ginefiv-Ginemed clinics in Spain. Dr. Llácer has various publications in the most representative journals in assisted reproduction and pharmacogenomics. He takes part as a reviewer in the most representative journals in assisted reproduction, and also as a presenter in the most important conferences in reproductive medicines. He has been awarded by the American Society of Reproductive Medicine, the British Fertility Society, the Spanish Fertility Society, and Spanish Association for the Study of Reproductive Biology. So thank you for being here, and you can go ahead with your presentation, Dr. Llácer. Thank you.
Thank you very much for the presentation. Thank you very much for your perfect pronunciation of my name and surname. Sometimes it's difficult. And very, very proud to be here today. And thank you for the invitation to all the Bioarray team to participate in this important event, speaking about this trending topic that is the microbiome. So this is my most possible conflict of interest. And as a brief introduction, okay, we know about the microbials from a lot of years ago in the 18th century. We start knowing this fantastic universe of the microbia, and the gynecologists know a long time that it is absolutely normal that the presence of microbials in the genital tract. And well, we have for a long time a very, very good apparatus to have a very good image and culture of the microbials. But the interest about the microbiota is very recent. Okay, this is the evolution of the publication registered in PubMed, and the publication about the microbiome, the publication about the microbiome and fertility growth exponentially during the last years. But what is the reason of this special interest in the microbiome? The reason is that we have the genetic test, the next generation sequencing. We can have a lot of data, and we have the development of the bioinformatics, and we have the way to manage all the data. And in this way, we can discover the genetic trace of the microbials, and we can change in the last years the concept, because when we discover a bacteria, for example, in the genital tract or everything, we can understand that could be an infection or a saprophytic relationship. But now we have another concept, that is the concept of the eubiosis, or dysbiosis, and it's important in the health of and from several years ago, the project, like the Genome project, is the Microbiome project, and we can discover more or less the bacteria, the microbiota in the human body. And we started to understand that there's some regions in the body that we considered previously they have no microbials, have microbials. In fact, we found that about 10% of the microbiome is present in the urogenital tract. So it's quite important in the health of our patients, like indicated by Luis at the introduction. Okay, and we studied the microbial tract, and we can evaluate the situation, and not only the vagina and the endometrium, in the tubes and in the ovaries, even in the ovaries. And we have several biomarkers in the study of the microbiome, different biomarkers with different meanings. For example, the microbial load could be important. The microbial richness is another biomarker. The taxonomic distribution, the dominancy of species, genus, or family, and the diversity, especially the alpha diversity, that refers to the mean species diversity at the site that we are studying. And the vaginal urogenital microbiome, the main characteristics is the high microbial load, very high microbial load, the lactobacillus dominance, and the low diversity. This is absolutely different than the other parts of the body, especially the gut, where the high diversity could be good, and the dominance of one or another could be absolutely different that we expected to find in the vaginal microbiome. And we know from a long time that they try to clusterize the microbiome in the vagina, and we try to clusterize in the CST, the community state types, and we have about 5 community state types. Depends on the dominancy of the different species of lactobacillus. Okay, and the CST1 is the Lactobacillus crispatus, the 2 Lactobacillus gasseri, the 3 inners. The 4th is usually good Gardnerella, but with a great diversity, and the number 5 is the Lactobacillus jensenii. Okay, so it was a very, very important introduction of Luis Alcaraz, speaking about that the microbiome is different in the different parts of the genital tract, and the lactobacillus dominancy is bigger in the vagina than in other parts, and this is quite important, and we will come back this concept at the end of the later. And we know that in patients with recurrent implantation failure, the microbiome is different than in patients that have no fertility problems or patients that are in the IVF but become pregnant. This is quite important, the relationship with recurrent implantation failure, because this is the target of the patient that usually we check the microbiome before starting a new treatment. And well, this is a study with a relationship about the relative abundance in the vaginal microbiome and in patients that receive a chromosomically normal embryo, and the results were different, and the probability to have a dysbiosis in the patients that failed to become pregnant was higher. This is another study that even depends on the species of Lactobacillus. The probability of pregnancy could be different in assisted reproduction, and this was an important study published by Moderator in 2019, and because the differentiation of different clusters of population of microbials in the vagina, and in every cluster can distinguish the patient in the good prognosis, fair prognosis, and bad prognosis. And it was a good approximation to the study of the microbiome. But without that, the studies that mark the interest about the microbiome was the studies by Immaculada Moreno, and refers that well, the microbiome in the endometrium is related with the success of the IVF treatment, and a lactobacillus dominance in the endometrium is related with a good prognosis for implantation and a good prognosis to avoid a miscarriage, and of course to have a live birth. This is a bit controversial, and this is the results of a study that is ongoing in our clinic. And when we check the vaginal and endometrial microbiome in patients with recurrent implantation failure before starting a new treatment, and well, the probability to find this dysbiosis is higher in the vaginal microbiome than the endometrial microbiome, 29, but 80% in the endometrial samples. But this is quite important, and this is a key situation in the study of microbiome vaginal versus endometrial, is that the considering the reference, the endometrial microbiome, and this is very questionable, but considering the reference, the vaginal microbiome, the endometrial microbiome, the vaginal microbiome have a sensitivity of 100%. So all the samples that are dysbiotics in the endometrium were dysbiotics in the vagina. The specificity 81%, the positive predictive value 62%, and the negative predictive value 100%. So all the samples that are dysbiotics in the endometrial sample were dysbiotics in the vaginal samples, and this is quite important to consider, because could be an important information to avoid to do a biopsy in the patients that have an alteration in the or previous alteration in the microbiome, because the vaginal microbiome could be enough. And we are a bit worried because they taken into account this study. We can suspect that a lot of the endometrial microbiome could be a contamination of the vaginal microbiome, and could be at least with the same sensitivity and specificity to do a vaginal microbiome. But we can discuss about later in the question and answer part of the webinar. And the other situation is if we are able or not able to change the microbiome. This is very controversial. Okay, this is a meta-analysis about the treatment with probiotics and the influence in reproductive health. Okay, and this is an important study by Tana Punjawat, published recently into 2023, that is the pregnancy outcomes after the vaginal probiotic supplementation before frozen embryo transfer. And they can randomize 340 patients. This is a very good number. And we study in different samples. And they found that the probability of pregnancy was not significantly different, statistically significant different that with vaginosis or not vaginosis, but the probability seems to be lower in patients with vaginosis. And the other parts of the study consider that the probability to have a live birth was better when the patients were treated with probiotics. The clinical pregnancy was the same, and the ongoing pregnancy rate was not different, but the live birth was especially or significantly different because the miscarriage rate was lower. So probably the influence of the alteration of the microbiome could be related more than with the miscarriage than with the implantation. So this is another issue that to consider in the future. And this is another interesting study by Jackson in 2022. It is what's interesting because they could randomize 77 patients to receive with a bad profile in the vaginal microbiome to receive probiotics or placebo. And as you can, sorry because the slide, because it's a bit complicated, but you can see in the right chart, some patients improve the vaginal microbiome. But the main problem is that the improvement was in the same rate in the patients treated with probiotics that in the patients that didn't receive probiotics. So, the situation could be very controversial in that the probiotics could improve the vaginal microbiome or not. And this is another review that we published in our clinic with Claudia Blancafort about the possibility of the evidence that if we can change or not change the vaginal microbiome with probiotics. And this was the conclusions that the bibliography is not very conclusive about the possibility to change the vaginal microbiome with probiotics. And we consider that it's quite important, and the work of Dr. Raimundo was very important in order to consider exactly the composition of the probiotics, because the probiotics is a very wide concept. And in the future, we must consider that what is the best probiotic and what is the best oral or vaginal administration. Okay, so the probiotics, the possibility to have problems or secondary effects is very low. So we are not especially worried. But the consideration of the most important societies are not considering that the indication of the probiotics is practically mandatory in the patients, and the evidence is limited, and we have a lot of tasks to do in the future in order to well, to study that what is the best approach to treat the patient with this biosis. And finally, this is another option, and we can consider that it could be a good option in some patients with recurrent alteration of the vaginal microbiome, is to use antibiotics, not only probiotics. Okay, so well, we have a very limited studies, but probably it could be promising that in case of the recurrent alteration of the vaginal microbiome, we can treat with antibiotics before starting the administration of probiotics, and it could be an interesting option in order to correct as a conclusion. This is the conclusion of the paper published by my colleague Juancho García Velasco, and the idea is that in some patients with recurrent implantation failure and alteration of the microbiome, we need to check the microbiome and to treat with probiotics, and probably the antibiotics could have a role. The antibiotics should not be used on a routine basis to change the vaginal typology, and of course the lifestyle change could be an important option to treat these patients, and considering to repeat the vaginal microbiome and to plan the embryo transfer after checking that everything is okay and we have an optimal microbiome in the vagina. And finally, when taking into account that in assisted reproduction, in reproductive health, it's very difficult to arrive to evidence and strong conclusions, and taking into account that we have some patients that fail to obtain a pregnancy, and the idea is to explain the patients the current evidence, and to make decision altogether. Okay, to plan the treatment using probiotics or antibiotics in case that we detect that the microbiome have alteration. So this is all. I'm ready for the questions section. Thank you very much.
Thank you very much, Dr. Llácer. Thank you very much also, Dr. Raimundo, of course, Luis Alcaraz. We have some questions, but we noticed that maybe both of you, Dr. Raimundo and Dr. Llácer, can answer to this question, so maybe it can create a small debate here. So the first question that we received is, the question is, are all species of lactobacillus equally important to achieve a pregnancy? They mean, is it better to have one species versus another? And if so, is there any implication regarding the probiotic we have to choose in our clinic? If you want me to repeat the question, I can.
It's possible. I have with these questions. I think in the future, any person, any man, any human, we have a specific alveolar microbiome. I think in the future we have probiotics specific for this person. At this moment, we have a lot of probiotics. Only one species, more species, vaginal, oral, but it's important, and Professor Joaquin explained, it's important, we need more evidence which species is better for better for IVF treatment. If you prefer oral probiotic or vaginal probiotic, in Europe, for example, it's difficult to regulate a new probiotic by vagina because it's considered vaginal device, not a medication, not a supplementation, and we have too difficult to do a probiotic inside for vagina. The new probiotics all oral, but we need more evidence. All studies we spoke, this 3-year presentation, it's different lactobacillus and it's randomized with different lactobacillus. We need more. I use probiotic, not for all patients, but we select the patient who need probiotic. But I think in the future, we create a specific group of probiotic for any patients. But at this moment, we use lactobacillus. It's more frequently different species of lactobacillus. It's depending on the country. There are probiotics in Portugal, different in Spain. But it's important we check if we have any publication about this and do not use probiotics for gastrointestinal. We use probiotic for fertility. In beginning, we use probiotics for gastrointestinal disease, not for fertility patients. But at this moment, we don't know the best lactobacillus or the best probiotic for the patients. I don't know if Professor Joaquin said the same, but
absolutely, absolutely. I think that we are in the beginning of an interesting time. And well, I know that the Bioarray is well, continuing investigating every day the new advances and well, we will change the concept that is lactobacillus dominance or not lactobacillus dominance, and we can consider especially using the bioinformatic methods, that is the pattern of the best pattern of the microbials in the vagina, because the different species of lactobacillus can have different actions or different effects. Okay, so well, we try to investigate more in this direction, and the treatment, the probiotics. Well, probably the oral probiotics could be an interesting option. And the design of the best probiotic is another challenge that we have nowadays. Okay, I think that probably we can have another field of investigation, is that the microbiome of the gut could be important as well to be considered in the fertility. Okay, because we know that the local microbiome could be important, but the gut microbiome, well, could be related with the immune system and could be related with inflammation. And well, we think that we must consider in the future the possibility that the gut microbiome could be interesting to check in patients with recurrent implantation failure or infertility.
Yeah.
Yeah, I fully agree, because you know, when we performed this study in which we analyzed samples from different parts of the body in patients, we expected to find a stronger correlation between the gut microbiome and the vaginal microbiome, but our surprise was that we found a better correlation between the oral and the vagina. But I think it's just because we didn't knew how to treat the data that we get from the gut microbiome, because it's so complex and so many species and interactions and so on. Yeah. We have one question that is related to this one. That is, I think, is very interesting. That is, what about the treatment of the male partner with probiotics? I mean, it's frequent to analyze the microbiome of the male partner, and if you found any dysbiosis in the male partner, is useful to treat with probiotics?
Usually, I study on implantation failure or with patients with bad results, not in the rules to do this. I don't know.
So I think that it is an interesting. Well, it is a good question, because nowadays some colleagues that are andrologists, okay, when they found a male factor, the best approach, the first approach after ruling out the genetic causes and ruling out the hormone causes, they do a microbiome in the sperm in order to exclude the possibility that they have a dysbiosis, and in this case, they consider to treat. But we have some publication in this direction, but the evidence, in my opinion, is very weak at the moment.
Yeah.
Okay. We have another question. Okay, what do you do when you have a patient not responding to antibiotics treatment?
I don't listen well. Can you repeat, please?
Okay. What do you do when you have a patient not responding to the antibiotics treatment?
It's a good question. But when I do microbiome and we have, for example, these patients, I explain with 3 bacteria, we repeat microbiome or not repeat the microbiome. It's not clarify if you need to repeat the screening or no. But it's unusual you have these patients, we have a resistance with bacterials. Sometimes what I do, I change the antibiotic or contact the lab for study which best antibiotic for this species and select if we have any sensibility or resistance for this antibiotic. But sometimes I have a questions if I need to repeat or not repeat, depending of the cost of this or if you have impact for the treatment. But usually I contact the lab and ask if the antibiotic we have the best for this bacteria.
In my clinical practice, we don't use the antibiotics for the dysbiosis. We use antibiotics in case that we detect a pathogen related with chronic endometritis. Okay, and if we suspect a chronic endometritis because we have a pathogen in the result of the endometrial microbiome, or because the CD138, we use antibiotics, and the rate of that we can correct about 80% with the first cycle of antibiotics. And in case that we have a resistant, we change the antibiotics. Usually we start with doxycycline, and in case that we change, we change to a cephalosporin. And but with the dysbiosis with no pathogens, okay, we use the antibiotics when we repeat after treatment with probiotics, and we have the continuity the dysbiosis. We use usually local metronidazole and beta-lactamic, oral beta-lactamic, and probiotics. And the experience is good, and in the vast majority of the patients, we can correct the dysbiosis.
Professor Joaquin, we repeat the study after the treatment. After 14 days, we repeat the biopsy, or you repeat the exudate of the vagina, or no?
Yes, when we have a pathogen with we suspect a chronic endometritis in a recurrent implantation failure, okay, we repeat the sample in order to be absolutely sure that the chronic endometritis is absolutely solved.
Okay.
In case that when we have a recurrent implantation failure, we plan the next embryo transfer when everything is perfect, and we correct everything.
Okay, I think that's what you said at last has a relation with one question I wanted to ask Luis Alcaraz about. Is do you recommend the second biopsy and vagina sample to see, yes, if to see the recovery of the endometrium after treatment, or it should be enough only with the sample of the vagina?
No, but nowadays depends on the situation. But usually we do the study of the microbiome in the middle of exploration about recurrent implantation failure. Usually we do a hysteroscopy, and at the same time we do the biopsy to be considered to the study of the microbiome. And sometimes at the same moment we do a study of the window of implantation. But in case that we have pathogens, and we repeat the endometrial biopsy, but in case that we have this dysbiosis, in the next control, we do a vaginal sample.
Mm-hmm. Is it the same for you?
I think it's the same. Sometimes I repeat, then other times it's not repeat. But usually I will try to repeat the biopsy for checking if all fine.
Mm-hmm. And we in the lab, Luis Alcaraz, what do we do?
Yes, I think we are all aligned the same way.
Yes. Okay, so I have another question. It's really interesting. So the person says, hello, everyone. Thank you for the amazing presentation. So thank you. And this question is general, so feel free to express your opinion. Okay, the question says, do you believe the understanding of personalized microbiome, endometrium, and vagina can help us approach patient and treatment with combining different microbial supplementation, probiotic and antibiotic, in order to enhance clinical outcomes?
At this moment, it's not possible. We adjust a cocktail with specific for the patient. We need to choose any probiotics, any prebiotics in the market. But I think in the future, yes, it's optimized for specific patients. I think it's the question, yes. But at this moment, it's not options. But in Portugal, for the vitamins, it's possible we create a manipulated for a specific disease, anti-aging, some endocrinologists to use for fertility. But gynecology and doctors with IVF do not use these. I create a specific probiotic. First, we need to know which the best lactobacills who affect fertility. After this, it's possible we create a specific cocktail with probiotics and postbiotics and prebiotics to increase the pregnancy rate.
Dr. Llácer?
Oh, absolutely. This is
So
okay, but we can consider probably in the near future that the personalization is the future, but we can consider that artificial intelligence can help us to mix different biomarkers, not only the microbiome, but probably genetic biomarkers or other biomarkers of the patient to consider to personalize the treatment and personalize the diagnosis.
And do you have any preference or recommendation about the brands or type of probiotics to use, or for the moment, no?
Not for the moment.
Yes. So, okay, perfect. Thank you. We had another question, but I think that Luis Alcaraz talked about about the male. Okay, I had a question here about the seminal fluid. Yes, because okay, so what about the importance of the microbiome of seminal fluid? Any comment about that?
We have the same questions two questions ago. The seminal fluid, usually I will send to urologists and adjust this if you have to check the male microbiome or not the male microbiome. I think it's at this moment it's unusual to use this, but I think there are some studies, and I put in the presentation on studies with seminal foods. It's important to check this, but at this moment we don't use for the routine.
Another interesting question. Is it interesting to add the results of different microbiome profiles with different age groups?
Yeah.
Plus the use of supplementation during fertility treatment, for example, prior to IVF cycle, can be sufficient when time is scarce in order to produce significant improvement. So the question basically is about, is it interesting to add the result of different microbiome profile with different age of groups during the IVF cycle?
Our microbiome changed during your life. I show a slide with this only to breeding or fertility age or perimenopause. We have 5 groups of lactobacillus, and we need to know in these 5 groups we have the best to impact for the fertility. And if you need, for example, supplementation probiotics for patients with egg donation with old patients or the young patients, we don't need. We don't know at this moment if we have a specific group who need probiotics and another group who don't need probiotics. But we need to wait more evidence, and a lot of groups and a lot of studies with these analyze the different microbiome in different phases of the human.
Definitely. We must. The microbiome can change during the cycle, during the age, and to be different. This is the reason that this is quite important to prepare the patient in the more or less in the same condition that we are going to do the embryo transfer. To be more well to improve the accuracy. Okay, and could be important because sometimes a patient is trying to egg donation and is with menopause, and we must prepare the patient in the same condition to do a mock cycle and to take the sample during the mock cycle and not before starting the preparation for the embryo transfer.
Okay. I have a question from one partner in Saudi Arabia. So he is asking about after an antibiotic treatment for the pathogenic bacteria, also beneficial lactobacillus will be eradicated. So what we will do? Shall we use the probiotic immediately or wait a certain time for after the complete recovery?
When you take probiotics during the antibiotics, do not destroy the probiotics, but we need to take not in the same time. I think the same questions in a meeting 1 month ago. It's possible we create the same times antibiotic and probiotic, and some articles do not affect. But usually you prefer first antibiotic and next probiotic, okay? But the article about this, it's not affect if you take 3 hours, 2 hours after the antibiotic. But usually we take it after. I don't know if Professor Joaquin take.
Absolutely.
Yeah.
Absolutely. The cycle of probiotics must start after finishing the antibiotic. Yes. And we try to use probiotics in all the times that we use antibiotics in the patients during the treatment. We use antibiotics not only because they have a chronic endometritis, because another causes, gynecological or not gynecological causes, we start a probiotic cycle after finishing with the antibiotic.
Okay, so thank you very much for answering the questions, for your presentation. And Luis Alcaraz, I don't know if you want to add something more.
No, just to thank you, thanks the speaker for the nice presentation. It was very, very interesting.
Thank you.
Thank you very much for your invitation and congratulations for the webinar. Very, very, very interesting.
Yeah,
Thank you
congratulations.
for coming. And I would like to thank everyone for that. And of course, if you have any question later after this webinar, you can contact us at bioarray.es, and we will be more than happy to answer to your questions. Okay, thank you very much for this webinar.